Hello, thank you all for joining me today. I'm so excited that my spring 2021 microbiology students at Lakeland Community College have volunteered to assist in talking about coping during the pandemic. More specifically, our topic being that knowledge is power. So, I want to present some questions to all of you and discuss how concepts from our class, along with specifically in science, technology, and in microbiology, have changed how we have thought about things in the last year and more specifically related to the pandemic. So, the first thing that I wanted to ask you guys are what are some topics from class that you have learned that may have helped you to understand the current COVID-19 pandemic a little bit better? Don't
So
all
for
chime in. Go ahead.
so for me, learning about the overall abundance of microbes just being around us every day has made me very conscious of my decisions out in like society, I guess you can say. It's also made me more conscious of if I'm bringing them home, I make sure I clean my house at least once a week, and just helped with my knowledge of like what could be out there, what can make me sick, and how I can change my personal life.
For me, I think the labs were very helpful to understand how viruses actually go from one area to another. I mean, like when we talked about the hand washing and transmissibility labs, to me, those were like the foundation of understanding how, microbes are transferring, especially when you think about as I believe Michaela just mentioned about, going from one place to another when I'm at work and then coming home and how I could possibly be bringing something from work to home and actually vice versa.
And for me, is how virus is dead, actually. So lots of people don't know viruses are not living; they are dead, and so they are RNA virus, and they've been around actually long time. So there is great resource out there, and it's there is four coronaviruses actually. Sorry about that. There's four corona types of viruses. It's alpha, beta, and gamma and delta. And what we're dealing right now is actually is CAR, which is beta, and the first human coronavirus was identified in 1960. So, and another thing I would like to add, for me, it's also how to prevent coronavirus, what we should do and what we shouldn't do.
That's great. That's great. Microbiology student 4, do you mind sharing when you were talking about how you clean your house frequently? Have you had a cleaning product that you found to be more helpful? Maybe something you learned from your disinfectant exercise that maybe you prefer to use over others?
Um, Yes. So, actually, in doing some of these labs, I did realize that there's a lot of great products out there, but the one that I stick to the most is just the old-fashioned vinegar with mixed with water or whatever, because you can use vinegar for just about everything, washing pots, cleaning windows, your clothes. So to me, yes, I like Lysol and other great products, but vinegar is probably my top choice.
Sure, sure. And we listed in the coronavirus lecture notes a couple of microbes, specifically that, disinfectants that work with different microbes and one specific to COVID. So that's fantastic to use some of the lecture information in terms of how we clean our homes and disinfect and things like that. So I have another question for you guys. Hand washing, right? So hand washing. What have you learned about proper hand washing? Do you think the general public's doing a really good job on proper hand washing protocol now that you've learned about it? But also, what are some things that you might think differently about or do differently based on how you've learned about hand washing and microbes associated with transfer from our hands to others, and to surfaces?
I feel like I wash my hands more than I used to just from knowing that there are viruses or microbes on like everything that I touch. Like, because someone will touch something and I don't know that they touched it, and then I'll touch it. And I just feel like, high traffic areas, faucets, cabinet doors, car doors, I mean, really anything. And if you can't wash your hands like right away, I mean, hand sanitizer, as long as it's 60%, it's good enough. So just that.
For me, it's a 40-second rule. CDC recommended 40-second rule. So I did not know that, but I think with 40-second rule, it's really cool thing to do. It's like you sing your favorite song when you're doing that. So, but there is a very specific way how you should wash, because often we not wash very well our hands. So we need to do that like really, really good before we even open water and putting soap our hands. That's where our 40 seconds starts, not before that. So, and what I found out often with this class, often there is actually study in where women wash their hands more when men do. Yeah. And there was like, I think it was like 75% and 10% men. And in a general, there was a men and general average people who go in and out, they do like 1 minute, less than 10 seconds actually, and you get lucky if they do even sometimes. So
Well, and we learned a lot of places that we don't realize we're supposed to be washing better, like the backs of our hands or in between our fingers, even our thumbs that people forget. One, arm's length up on the wrist, where a lot of these things are acquired. How important is hand washing, given that most of you are planning a career in the healthcare field?
before you
It's
see a patient, go
and
for it.
it's really important for me because I think about it because even though we do have accessibility to sanitizers, there are some microbes that is resistant to that and they will still live on that surface. So hand washing is very important when you dealing with like C. difficile, and you have to wash your hands. There's no way that you can sanitize that kind of microbe away. So it's important, and especially when you're in an environment that you have so many microbes and germs around.
Yeah, the nosocomial infections that we talked about. Absolutely. So here's another question I wanted to pose for you guys. Looking at physical distancing. So we talked a little bit about like our hands and things like fomites, but then the aspect of a communicable disease is important, but also some other ways that you can contract coronavirus. So what are some things in terms of physical distancing and also importance of the fact that us, our role, and others that may in fact be infected? So something you might want to add to that concept.
I think generally like people don't realize how far a sneeze can actually travel. That's something that we shared in one of our lectures,
Mhm.
and it can go up to a couple meters, I believe. And so it's
Yes.
just kind of like gross to think about if somebody sneezes 10 minutes ago and then you're in that same space, is it still there? Are you getting the same germs from that person? And it's just a different way to like have a perspective, like, okay, I'm going to be physically distant from somebody so I don't get their sneeze on me.
Actually, fantastic you brought that up, because the next concept I'm just going to jump ahead to is actually masks. So the physics of a sneeze is something that you brought up. Is the physics of a sneeze or the power behind a sneeze different if your mask is on? Where does the sneeze go if you're wearing a mask versus where does that sneeze travel with a properly fitted mask on? So we watched some videos on this. So what can you add to me? There was a physicist and a immunologist that recorded some videos regarding this. What do you think?
So it definitely kept the sneeze like way closer to the person who gave it off. Um, so basically, it wasn't going a couple feet in front of you. It was controlled by that mask. So it helps with the spread and the transmission of other microbes.
Mhm.
And what about masks in general?
Mask in general, I mean, mask, you should be wearing a mask, but it's not just a matter of just wearing a mask, but wearing one that's properly fitted for you. Because a lot of times people, when they're wearing masks, they're actually wearing it up below their nose, so, and they can still get infected, through their nasal mucosa. And so you really want to make sure that if you're wearing a mask that is fitted to around your face, that your nose and mouth and probably under your chin is covered, because actually those are the places that you tend to touch. And then at that point, all you have to do is worry about not touching your eyes.
People don't think about like gaps too in the mask.
Mm-hmm.
So if you're breathing and there's a gap in your mask, you can still get the airborne, you know, what are they?
Those
The air,
respiratory
yeah,
droplets.
the droplets. That's what I'm trying to say. They still can go through, your gaps. So just want to make sure it's tightly fitted all the way around.
Terrific.
Mask is a good barrier for droplets to go around, and you protecting others with getting also sick.
Yeah.
Mm-hmm.
That's the main thing, basically.
The blue side out. Blue side out, not white.
So let me jump back to something. This is a big one. This is something talked about in many classes within the sciences, but this is something that isn't always within our control, but it's something that we can do on an individual level to help us assert some control during a pandemic. So what are some ways that you can boost your immunity or prevent the breakdown of your immune system or try to prevent yourself from getting ill?
You have to be hydrated, a lot of water, drink a lot of water, and be healthy, eat good stuff like healthy food, vegetables, fruits, exercise, avoid alcohol, smoking. Lots of good stuff.
And to add on, oh, I'm sorry, go right ahead.
Go ahead.
Okay.
I was just
to
going to
add
say
on,
getting rest. That was all. Getting some rest and sleeping, letting your body having a chance to regenerate and letting it rest and repair itself.
mm-hmm, absolutely. And I was good, to add to piggyback on that, I was going to say is, definitely washing your hands frequently, so that, and then cooking your meats thoroughly and minimizing stress, and definitely keeping up with all the recommended vaccines, which I think is really huge.
Anything else that you other ladies might be doing to boost your immunity?
Me personally, I took time to manage my stress during the pandemic and keeping it as kind of like a minuscule level as much as I could. With that being said, I like to exercise a lot. It releases all those good endorphins. So getting outside, feeling the sun on your face is one of my favorite activities. So.
Nice.
I eat lots of apples.
Yeah. Lots and lots of good stuff there. Okay, so one more thing I just wanted to kind of touch on, which is probably the most important. And it's somewhere that maybe a lot of us have fallen short in general, but where do you get the best information for science and health? What are the websites we should be going to? What are our resources that we should be using to gain accurate science and health information? Because if knowledge is our power in coping during a pandemic, since many of you are going into the health professions and many of you have chosen to take science courses during a pandemic, where do you get the best information?
I go to the CDC, Center for Disease Control. It's very up to date, and I find a lot of reliable and credible sources.
Cleveland Clinic.
Yeah, they actually posted myth versus fact right on their web pages about several topics, including masks and vaccines and hand washing. So it's great. They've really broken down the information for all of us. Yeah, absolutely.
I also add Mayo Clinic. Mayo Clinic is
Yeah.
good. Hopkins Medicine. So,
I go to, I think the ohio.gov does a really good job of, sharing information. So, and then I also go to University Hospital's website as well.
It's wonderful. Yeah, absolutely.
For me, like if you're a person in the general public, I think enrolling yourself into a science-based class, like a microbiology class, is a great way to kind of educate yourself on what is out there. A lot of the stuff I didn't know before I took this class. So
That's awesome. Well, thank you guys for going on this knowledge journey with me and explaining how knowledge is our superpower during this pandemic, how we get these accurate pieces of information and how we use this knowledge and this information to help us cope during this tough time. And I wish you all the best in your health professions to come. Thanks for joining me tonight.
Thank you.
Thanks, Andie.
thank you, Andie.
Thank you.
All right.
If you or a loved one are struggling during these difficult times, please remember you are not alone, and together, we are resilient. Personal counseling and psychological services are available to every Lakeland student through the Counseling Center at 440-525-7200. If you or a loved one are seeking substance or mental health treatment services in the community, please call 440-918-2000 to reach the Compass Line, a service of the Lake County ADAMHS Board. Operators can connect you regardless of insurance to services not only Lake County, but surrounding counties as well. If you or a loved one are experiencing a crisis, please call the National Suicide Prevention Lifeline at 1-800-273-8255 or text the crisis text line by texting 4HOPE to 741-741. If this is a life-threatening emergency, please dial 911.